This is Miss Gray with Unit 8, talking about sleep and rest as an important functional health pattern and unit of assessment and an area of assessment in nursing. Probably a review for you guys is the physiology of sleep. You probably had that, some component of that when you were in A&P. You talked about the state, what sleep is, being an altered state of consciousness. You should have learned about neurotransmitters and the sleep-wake cycle. Those are important to know for the test, and that's just review things you've seen before. You should understand that darkness is a way of preparing for sleep, and that your pineal gland excretes melatonin, and you feel less alert. So during sleep, you have the gonadotropin hormone secreted, and cortisol is inhibited. What's important to know is understanding that there's a rhythm of sleep. This is probably still review from anatomy regarding the circadian rhythm and the synchronization that happens in your biological clock that creates the sleep-wake cycle. By 3 to 6 months of age, you should have a sleep-wake cycle. Now, your sleep architecture refers to the basic organization of sleep. There are two types of sleep important for your knowledge or understanding or differentiating between non-REM and REM sleep cycles. Let's see, non-sleep cycles. Your REM sleep occurs when activity in the RAS is inhibited. It constitutes 75 to 80% of your sleep and has 4 stages. You have characteristics of REM sleep you want to be aware of. Voluntary muscle tone is dramatically decreased. You might have deep tendon reflexes that are absent. You may be difficult to arouse during REM sleep. Your gastric secretions increase, and your heart rate and respiratory rate may be irregular. Other characteristics are that the regions of your brain associated with thinking and learning and organizing information are stimulated during REM sleep. And this is just an example, it's in your book, of a correlation of the time spent in REM versus non-REM. Now, really important for us as nurses is to really understand what is the function of sleep, because this is what we're really assessing for from a nursing perspective, is our clients receiving adequate sleep so that they can function and maintain their normal levels of activity, that they can have adequate protein synthesis, and have a good psychological well-being. Important again, you'll notice the theme of looking at the lifespan. Newborns need more sleep. They have shorter periods of awake time because they're growing. They enter REM sleep immediately, so that's that healthy sleep, and they have a sleep cycle. They go through a sleep cycle every 50 minutes versus us old folk. When you get to your infants, again, they awaken every 3 to 4 hours, then go back to sleep. Their periods of wakefulness do increase as the child gets older. You might have noticed that with your own kids. And by about 6 months, they sleep through the night, which I know most parents are really happy. And they establish a pattern of daytime naps. Toddlers, 12 to 14 hours of sleep are recommended. Most toddlers still do need an afternoon nap. And for toddlers, nighttime fears and nightmares are common. Preschool age children require 11 to 13 hours of sleep, and the school age child needs about 10 to 11 hours of sleep. Your adolescents, again, need more sleep again. You probably noticed that with your teenagers. 9 to 10 hours of sleep each night, and they actually, few get actually get that much sleep, but they should. In teens and adolescents, their circadian rhythms tend to shift, and they want to stay up longer and awaken later, which is why some high schools have changed their start times to be later to meet the needs of their teens. Your adults and older adults need, again, different sleep periods, lengths of sleep. Your adults 7 to 9 hours, and your older adults will tend to go to bed earlier and wake up several times. They may show increase in disturbed sleep, and for older adults, the sleep does not decrease with age. They tend to just need to rest. Factors that affect sleep, again, these are things we are assessing for. We're assessing for our patients. Are they getting adequate sleep? So you want to understand, again, what sleep is, that the purpose is to restore energy, protein synthesis, and provide for good psychological well-being. So if your resident or client is not getting that, then they might have factors contributing to their lack of sleep. Age, illness, comfort, are they in pain? Is their environment adequate? Does it provide enough quiet, relaxing time for them to sleep? Are they so fatigued and stressed they can't sleep? Is their lifestyle such that they're working so much and they're not giving themselves an opportunity to sleep? Are there emotional stresses? Are they smoking? Is there alcohol, diet? Are there medications like prednisone, steroids that are keeping them awake? Are they drinking coffee before they go to bed as a stimulant? Is that keeping them awake? So you want to assess the factors that can affect the patient's sleep, because you want them to have a good sleep biorhythm, being there's a good circadian rhythm, and have the appropriate hormone secretions. They will wake up and feel rested and able to function and meet their needs. The need for sleep exists for all human beings. It's a basic physiological need, and the consequences of a lack of sleep revolve around fatigue, lack of alertness, decreased pain tolerance, increased susceptibility to illness, and confusion and disorientation if the lack of sleep goes on for long periods of time. Again, you should know the two concrete stages of sleep and correlate the differences between the two. And again, know the different stages of sleep, 1, 2, 3, and 4, and the components of them. I don't need to read them off the board. Stages of sleep, again, you can look at it through a grid. You might have your pre-sleep, go through your 4 stages, sleep, and then hit stages 2 and 3 again. And this goes on in cycles throughout the night. Again, you should know the patterns of sleep across the lifespan. We're always looking at the lifespan, looking at the factors that affect sleep. Again, it's things you're going to assess for, understand the medications that can affect sleep, and the ability to rest and rest comfortably. You're looking at sleep disorders. These sleep disorders are testable too. Your primary disorders are insomnia, hyperinsomnia, narcolepsy, sleep apnea. You need to know those. Review them in your books. You can bring appropriate questions. Your secondary disorders are depression, alcoholism, dementia, Parkinson's. I mean, this is not the full list. This is just giving you an idea that there are primary disorders that affect sleep, and there are secondary disorders. So that when we can alleviate or remove the secondary disorders, the patient can sleep. If we can give them if the doctor orders an antidepressant, or if we can get them to stop drinking, or if we can minimize the dementia, or if we can make them more comfortable with their Parkinson's and adjust their meds, then they might have a better opportunity to rest well and sleep. And again, with your primary disorders, those are going to be your primary, the reason. So your primary disorders are just illnesses related to sleep. Your secondary disorders are other health issues that can cause a patient to have difficulty sleeping. You need to understand insomnia, narcolepsy, sleep apnea. There are different kinds. This is very testable. And you want to, very testable. So you want to know what are you going to assess for. Again, you're looking at getting a sleep history. We've talked about physical assessment. We've talked about communication. So we're looking at the patient holistically. You're going to want to assess their sleep disorders and get as much data as you can regarding their rituals, sleeping rituals, medication, the time that they go to bed, and how long they think they are sleeping. And then you have your nursing diagnoses related to disturbed sleep patterns. Again, and you're looking for the defining characteristics that point to the fact that your patient may or may not have a problem. Often you can ask if a patient has or a resident has a significant other. You can also get their input on how well they think their significant other is resting. Nursing interventions to promote sleep include in patient teaching, creating a restful environment, teaching the patient to avoid alcohol and caffeine prior to going to bed, and teaching them relaxation techniques as well. You can also plan to try to maximize the patient's sleep at night whenever possible. Schedule, from a nursing perspective, schedule as few interruptions as possible. Reducing noise and light. As nurses, we want to do our part to create a comfortable environment for the resident or the client. That's all. Good night, and you make it a great day.